One of the other more common injuries that we see in golfers is actually tennis elbow. And so even though it's called tennis elbow, essentially what that means is lateral epicondylitis, or pain on the outside of the elbow. Golfers tend to get tennis elbow on their lead elbow. So if you're a right-handed golfer, that means on your left elbow, so on the outside of your left arm. They don't usually get it on their right arm if they're a right-handed golfer. Now the reasons for that, we see lots of reasons for tennis elbow. Maybe you work at a desk job and you're using your arm a lot, but in terms of golf-specific activities, it's usually due to a poor position of your wrists at impact. And so a good impact position is when you come down to actually hit the ball, the wrist should be in a fairly neutral position, or even a little bit bowed at the left wrist, or a little bit of flexion, and cupped at the right wrist, so that the hands are leading the club face here. The hands are out in front of the club face. That would be a good impact position, or just more of a neutral wrist position. A bad impact position would be the opposite. So now we come down and we've got more extension of that left wrist, we've got flexion of the right wrist, and then we might even see what we call the chicken wing, so that elbow starts to flare out. When that lead arm, that lead wrist is in extension, when it's hitting the ball forcefully, or maybe even hitting the ground to take a divot, it puts a lot of stress all the way up through the elbow. And so these muscles on the lateral aspect of the arm start to get flared up, because that's not a natural motion, that's a lot of force. And so we start to see flaring up of these muscles and eventually the tennis elbow. And it can definitely be very painful, whether it's painful at impact, or sometimes people even have pain just trying to grip the club because those muscles are so flared up. So what I see a lot of times is people with traditional kind of treatment, they work on reducing the symptoms of the tennis elbow so that it feels better, which is fantastic. We definitely need to do that. But because there's poor mechanics in the golf swing, as soon as they go back out to golf and they still are hitting it with that bad wrist position, it's just going to flare back up again. So we need to make sure that they're actually coming through with a proper wrist position. Now, why do people tend to flip at it like that as opposed to have this good position? And oftentimes what we see is it's not actually a mechanic problem with the wrist, that it's not the wrist's fault, it's a problem somewhere else in the body. And so if the person doesn't know how to utilize their lower body enough to get power and to square the club face, then they're forced to use their wrists and their hands a little bit more at impact to try to square the club face. And so if when she comes on her downswing, if she hasn't rotated her hips enough and everything is just square at impact, she's got to get the club there somehow. And so oftentimes we see this kind of flip motion to get the ball in the air because her hips and her body haven't rotated. If she gets her hips rotated and she turns her hips towards the target, then the hands come back down through naturally and are in a nice kind of neutral or even a little bit of leading the club face position, which is ideally what we want. So we get the hips rotating, they square the club face, as opposed to relying on the hands to do it quite as much. And so a lot of our training is actually working in the lower body to get this movement to allow the hands to just fall naturally, as opposed to focusing so much on the wrists. And that's really what's going to prevent this pain from coming back in the future.